heavy and painful. Is it normal to have cramp-like pains even after my periods?
Yeah, thank you, Lucy, for this, for your effort to reach out to women out there and provide a bit of medical advice. I am Dr. Medad Mwevesa. I'm an obstetrician and gynecologist at Roswell Women's Hospital, Platinum Specialist Hospital, Kampala Hospital. I'm also a director at the new Fem Care Fertility Center, Lowoa. In regard to the first question that you put forward, I would like to give a brief of what the menstrual cycle is and what a normal menstrual cycle should be like. And generally, a menstrual period or a menstrual cycle is an interaction of body mechanisms, body hormones in a mature female with the essence of producing a single mature egg that would lead to pregnancy if fertilization happened during that month, or it leads to a menstrual period if fertilization shouldn't happen. The length of the cycle varies from patient to patient, but generally it's a range of 24 days to 34 days, normal cycle. It's usually defined in terms of regularity, frequency, volume of flow. Normally, the regularity might vary, and it varies between age groups, but generally between the age of 18 and the age of 25, the variability should be less than 7 days. Variability, I'm talking in terms of the difference between the longest time it takes to get the shortest cycle, the difference in time between the shortest cycle and the longest cycle. So below 24, between 18 and 24, you're looking at less than 9 days. Between 24 to 42, you're looking at 7 days. Above 42, you're looking at 9 days again. Generally, a normal menstrual cycle should not cause any form of distress to the lady. So any form of distress that happens during the menstrual cycle is not normal. This distress can be in form of psychological, it can be physical in terms of pain, it can be social in terms of discomfort that you get because of either the pain itself or how heavy the blood loss is. So any form of discomfort, any form of distress that you go through during the cycle is not normal. So back to the question, when you say the pain, the first 2 days the pain is crampy pain. There's variable causes of pain during, of course, the menstrual cycle might come with a bit of discomfort, but if the discomfort is severe enough for you to need any form of medical therapy, then it's not normal. Classically, that cyclic pain that comes around the time of the period is not normal, and it's associated with a number of illnesses, but much more commonly, the biggest cause for that pain is actually a disorder called endometriosis. It's a largely misdiagnosed problem, very hugely underdiagnosed, yet the history is usually classical and the investigations are available.
So, doctor, to ask,
Yeah.
when do I come to the hospital? Like, when do I come to the hospital because of this pain? Like, is it after, let me say, like, what time or what measure of this pain can I take so
Yeah,
that I come
any
and be
form
spread?
of any form of menstrual pain that causes you distress is not normal.
Okay.
Yes, like I explained, that distress can be psychosocial, it can be physical, it can be any form. You should have a period, you might have a mild discomfort, but you should stay functional. So if you're losing your functionality, if you're losing yourself because of pain during a period, it's not normal. It needs to be checked out.
Okay.
Yes, the commonest cause is endometriosis of pain, but of course this same pain would also vary. The causes are variable depending on age. So as women, especially when it comes to women who have not had as many children, or women who are going into their 30s, maybe early 40s, then those are ages that tend to have uterine fibroids. So uterine fibroids are yet another common cause of cyclic pain, especially during the time or around the time you're having your menstrual cycles. Then there is also a role of infections. Usually if you have a uterine infection, the pain during the cycle might be worse. But classically that pain of the uterine infection is not cyclic. It doesn't continue reoccurring because usually if the underlying problem, if the infection is picked out and treated and it heals. But of course you can get chronic pain from poorly treated or untreated chronic pelvic infection that has persisted for over a long time. But as a take home, any form of distress, any form of pain that disorganizes the lady's day-to-day functionality needs to be looked into, needs to be checked out.
Okay. Our next question is, why is it that some months the flow is very light significantly? Is it something to worry about?
It generally depends. When we are assessing how normal a menstrual cycle is, we don't look at just one isolated incident, one isolated menstrual cycle. We generally want to look at how the cycles have been over the last preceding 6 months. And classically, this applies to women who are not on any form of medical therapies, because some of the drugs, such as contraceptives, some of these herbs that some of our mothers do take, some of systemic drugs, like people who are on chemotherapy, who are on weight loss medication, who are on other forms of medicines. Some of these medicines actually carry side effects that would sort of give you changes in the menstrual cycle. But generally, menstrual flow should be predictable, should be at least, of course it varies from person to person, but generally it should be less than, you should have bleeding for less than 8 days. Hard to define volume in terms of, meals, and because it's a bit subjective, but generally we quote a value of less than 80 mils. Of course, this month it could be 60, it could be 80, but on average. But this takes us back to how we defined it, and any form of volume that causes any form of mental, physical, or psychosocial distress is not normal. So it needs to be checked out. So to answer her question better, we would want to assess and see how the flow has been for like the last 6 months, and then we'll be able to gauge whether it lies within the normal parameters.
Okay. You mentioned of weight loss, stress. How do these affect the cycle? Stress and weight loss.
It all starts with the brain. What we see as a menstrual period as an outward expression actually reflects how the balance of things is in the brain, in the tummy, in the pelvis, in the uterus, in the ovaries, because the message comes from the brain to the uterus, not from the brain to the ovaries, to the uterus, and finally you see a period. Classically, high stress levels, there is a stress hormone called cortisol. Cortisol is a stress hormone. When you're deeply, persistently stressed, you would tend to have very high levels of cortisol. And this cortisol in blood goes back and causes an inhibition of the normal flow of information in your system. And that's how stress, especially sustained episodes of stress, would actually cause you to miss your cycles. But again, people respond to stress differently. Some will respond to stress through overeating. And as they overeat, they are gaining a lot of weight. Now, as you gain a lot of weight, you tend to have a lot of fat under the skin. Now, the fat under the skin finally gets converted into the female hormone. So you start getting prolonged periods. But also, if you have other underlying conditions, you could also still present with missed periods that have had the high stress levels exacerbate other underlying disorders.
Okay.
Yes,
so in that regard, I think we can also answer this. How do I balance my hormones naturally?
There is a normal natural flow, and how you balance will depend on what is actually going on in your body. We are same people, but we have different bodies, and there are different issues that will be going on in our bodies, and unfortunately these other issues are going to have a direct or indirect effect on our cycles. But if I had to say this, actually generally for a woman to start menstruating, there is a critical weight, level of weight, and usually it's 42 kilograms. That's why you have women, younger girls, who have a bit more weight, especially in urban centers, starting menstruation much earlier, because the weight of our children in urban centers generally tends to be much higher than weight of children in the villages. So diet has a lot of effect on our menstrual cycle. We need to have appropriate feeding. We need to have proper feeding. If, of course, it's hard to provide proper guidance on nutrition, it's best handled by nutrition specialists. But generally, we need to handle ourselves in such a way that we are not becoming overweight, that we are not becoming obese. And again, we have to look at exercise.
Okay.
Now, exercise is very important to keep us in shape, but also it reduces our stress levels. However, over-exercising would also prevent us from having our periods. That's why when you look at athletes, these high-end athletes, a good number of them don't actually get their period.
So is it driving back to the fat that's converted?
Yes, there is
to the
fat.
hormones?
Yes, there is fat, but generally there are hormones that are associated with excessive exercise that cause a negative feedback into the whole cascade of events from the brain, and you miss your periods. And that's why most athletes don't conceive readily. For most of them to be able to conceive naturally, they would usually require a period of, either complete cessation of exercises or a drop down on exercise for the body to actually pick up and recover. That's why there is a variation, there is a level of exercise, especially when you're trying to make certain gains in terms of conception and things like that. We advise exercise, yes, but exercise in modulation, not extreme. Yeah, because that alone would affect the normal flow.
The cycle.
Yeah, the cycle.
Okay. Our other question is, after how long does ovulation occur? And how do I tell I am on my reproductive days?
Yeah, ovulation varies. Ovulation happens, cycle length varies from a lady to another. But on average, like we said, an average normal cycle is 24 days to 34 days. Now, the normal menstrual cycle is divided into two parts, generally speaking. There is the first phase, which is the follicular phase, and the luteal phase, which is the second phase. But literally, those phases feed into each other. What is standard and what is constant for all women who have hit menarche, who have started seeing their cycles, is the luteal phase is a constant, and it's 14 days. It's 14 days for all women. So if your cycle runs for 21 days, it means your luteal phase is 14 days, your follicular phase is 7 days.
Okay, maybe to enlighten us.
Yeah.
So what is the luteal phase?
Yeah, the luteal phase starts after you've ovulated.
Okay.
Yes, the follicular phase starts on the day you see your period to up to when you ovulate. So it stops when you ovulate, and the luteal phase starts just after you've ovulated.
Okay, so you can count backwards.
Yes, you can count backwards, but it's not like every time you have sex you're going to conceive. So if your luteal phase is 14 days, so the better way to count your fertility days is not from when the period starts. It's not from when my period is starting. Is to look at your cycle and deduct 14 days.
So that requires
it requires to track a cycle, and tracking a cycle, there are these apps, they are very helpful.
Okay.
But the way to count is look at when your next period started. Start from that day, count backwards, count 14 days backwards. Now, on that 14th day, because that's the day when ovulation has happened. Science is such that chances of conception are higher when already sperm is in the female system before you ovulate than if sperm is introduced in the female system after you've ovulated. So generally speaking, you're fertile for 6 to 7 days. So let's count, say, 3 days after ovulation and 3 days before ovulation. So you look at that week, 5, 6, those 5, 6 days. 3 days after ovulation, 3 days before ovulation. That's the time. But like I said, the more fertile window is when sperm is already in the system before, shortly before you ovulate, because that improves the capacity of sperm to actually fertilize the egg.
Our question is it normal to have cold stroke night sweats towards and during your period?
Yeah, there is what we call perimenstrual syndrome. And perimenstrual syndrome depends, the maternal perception depends on, it varies from patient to patient. Most of the time, mothers don't really experience any changes. Or if they do experience those changes, their bodies have gotten used to those changes that they are barely noticeable when they happen. But going back, like we said, the menstrual cycle is an expression of what's going on the inside. So depending on how the cycle is flowing, you're going to get different changes. And normally those changes come in form of mood. Some people become irritable around the cycle. Some might get breast pain or nipple. Suddenly the nipples become tender. The discharge, some get a lightish discharge, but usually generally the vaginal discharge would be expected to become more copious around the time of ovulation. So the best way to answer her question is, if you're getting those excessive sweats to the point that they are noticeable, we need to assess and be sure that there are no other coexisting conditions that are contributing to that, because excessive sweating is what we call hyperhidrosis, and there are clear specific medical disorders that can actually cause that, but the only way to tell is to have them checked out.
The last question is, what is your comment on PCOS and contraceptives?
Yeah, polycystic ovarian syndrome is one of the most common. Generally, when we sit in the clinics every day, we see these patients with polycystic ovarian syndrome. One of the most common causes of missed cycles, irregular cycles, but also one of the most common causes of infertility in women. And generally, in a normal cycle, from the day the period starts, a pool of eggs gets recruited in the ovaries. So those eggs start growing. About a quarter way into the menstrual cycle, normally you have a dominant egg outgrowing all the other eggs. So that's the egg that gets ovulated, and that's an egg that would either lead you to pregnancy, or if it doesn't get fertilized, the inner lining of the uterus will finally shed off and you get a period. So when you have polycystic ovarian syndrome, these eggs they get recruited and they start growing, but you don't quite regularly form that dominant egg. So as the eggs reach a certain stage, they get arrested. They stop growing. And because they stop growing, you don't have a dominant egg that would normally give you pregnancy. And because you're also not ovulating, you're not forming the corpus luteum, you're not producing the required hormonal changes, so you end up also missing a what? Missing a period. So it's a very big disorder. It's a lifelong illness. We don't have cure for polycystic ovarian syndrome, but it can be managed depending on what the target of this different patient is. If the target is regular cycles, we are able to achieve that. If the target is pregnancy, we are able to achieve that. Some who have polycystic ovarian syndrome have excessive body hair growth, have male pattern hair growth. So we have to control that. Some have a lot of pimples, a lot of acne, and it has to be addressed. Or some are struggling with frank conception. So then we put in place measures to help them with conception. Now, patients who have polycystic ovarian syndrome, as they grow into their later years of life, they are at a higher risk of getting diabetes, mellitus. They are at a higher risk of getting cancer of the inner lining of the uterus. And most of the patients who have, there are two types of PCOS. There's one that you find in very thin women, but it's much more common that people who have polycystic ovarian syndrome have a higher BMI. That's why weight loss of just as much as 10% goes a long way into changing the outcome of these patients. Actually, some miss periods and all they have to do is lose weight, and the periods will come back. Some just lose weight and conceive. So now we use oral contraceptives in PCOS, one to regularize the periods. It's not like we are giving, it's the same medicine, but we are not giving it to achieve contraception. We are giving it to help us reverse the normal changes, the hormonal changes that are happening to patients with PCOS, such that they are able to see their cycles. These cycles can be just for psychosocial treatment, because these ladies need to feel that they are going through cycles just like their colleagues. But also, if a lady is getting one cycle every 3 months, that's sufficient in terms of reducing the risk of cancer of the endometrium, of the inner lining of the uterus later on in life. So if they are missing a lot of those cycles, then usually we give them oral contraceptive pills to help reduce that resk. But again, also when we are looking at women who have PCOS and are trying to conceive, before we help them, before we induce ovulation, before we give them medicines to help them ovulate, we give them pills to regularize the cycle, also to control the cycles such that they are predictable, so that we are able to time when to put in place specific interventions in terms of medications to be able to track their cycles and help them to conceive.
Okay, so the contraceptives are more for the good of the patient, not for them to worry.
It's all about explanation, because there is stigma around some of these diseases, but then there is also stigma around the interventions that we put in place, especially contraceptives, because people don't want to be seen swallowing these medicines sometimes. But yes, they have a huge role. They play a very huge role in the management of polycystic ovarian syndrome. But of course, as we take them, they could cause a few side effects, so the physician who prescribes them has the responsibility to make sure they explain what is to be expected while you're taking the prescribed contraceptive.
Okay, thank you, Dr. Mede. What or message to the ladies out there about their cycle?
Yes, the message is if you're getting troubled, any form of trouble, could be in terms of pain, could be irregular menstrual flow, could be in terms of psychosocial stress, any form of distress that you get either during or around the time you have your cycle, you need to get it checked out. Yeah, because there are very clear causes of those menstrual irregularities, abnormalities. The causes are very easy to figure out, to identify, and treatment therapy is available. And for the most part, it's not expensive, depending on what's happening. So people need to reach out. They shouldn't suffer. They are probably spending much more money trying to seek temporary measures on the long term than they would spend if they would get this checked out, diagnosed, and get the right form of intervention.
Okay.
Yeah.
Thank you for your time.
Yeah, thank you so much, Lucy, for coming by. We appreciate the effort. Information is nice when you share it, because we are here to make a difference in people's lives. So I'm glad we've had this opportunity to put a few pieces of information out there, because they could help somebody.
Okay.
Thank you so
welcome.
much.